Hi, welcome back.
Welcome to the Gold Room Podcast with your hosts, Sophia Garcia and Taskin and Sophia. Tune in as we interview those affected by childhood cancer, gather their perspectives, and help others find comfort in their expertise.
Today we'll be discussing the topic of psychological impacts of cancer in kids. So I was interested in talking about this topic because I know very little about the psychological impacts of cancer as a whole, and especially cancer in kids. So I feel like it's a good topic to discuss on the podcast because I not only can learn more myself, but we can educate our listeners through this because it's very important to talk about. And also we can try to find ways to better handle mental health through our research and especially during after the cancer process.
So for me, oftentimes the mental aspects of cancer is not talked about a lot. And I think that personally we should focus on that to be able to uncover other ways to help children with cancer. Oftentimes we focus on the physical aspects of getting cancer. And I just think that if we learn how cancer affects the mental state of children, we can find better ways in comforting children.
So all I really knew before doing my research was that mental health and throughout the cancer journey is just not prioritized and physical health is seen as above it. And I just knew that overall, because I feel like physical health, even just in general, it's just always seen as less than mental health, even though that's not the case at all. And also when I feel like we touched on this with our first episode with Michelle, and that just kind of opened my eyes to want to talk about the topic more. And I also feel like the brain would have a lot to do with it, some maybe cancer, or not just cancer, cancer treatment because of chemotherapy and things like that, it would have an impact on the brain. And I feel like that would in turn cause some mental effects. And also just the mental part of the journey, knowing that cancer is such a large issue and it could come back or never fully go away. I feel like that would have a large mental impact. And then just from our first episode, again, it just seemed like the therapy and support options weren't really the best, and some hospitals don't even offer the support programs. But I feel like at least some hospitals should have support programs or do have support programs. And I don't think they probably would be. I feel like they'd probably be expensive, and that's maybe why there's a lack of access. So, yeah.
So I think that the mental toll on cancer, if we look besides cancer, we can see that within our society, mental health is not often valued. It's often physical health is often valued over mental health, which both are equally important. And so in our society, because we don't really focus on the mental aspects of anything, honestly, I don't really think any of us really do go in depth into the mental aspects of cancer specifically. But I do think that cancer does cause a mental toll on its patients, especially because, as you said, cancer is such a huge thing, and it definitely does affect children. And especially because children, they're not used to being in and out in hospitals and having to be there for so long without anyone else socializing or anything like that to get treatment for cancer. I do think that eventually does take a mental toll on them, especially because they're children. They're not used to it. And so being exposed to such environment at such a young age does affect them, I do believe.
Yeah, I think that just because cancer is how you're talking about, it's physically draining, that's such a huge part of it. And even just as a child, I feel like most children don't know that much about cancer. So just getting it all of a sudden, that has to be it changes your entire lifestyle. You can't go to school, you can't see your friends, you have to focus on your treatment, and that could be really hard. And because a lot of maybe if a kid does have cancer, maybe their friends don't know that much about it, or their parents don't want them to know that much about it because they're scared talking to them about it. That could in turn make it so they don't get to see their friends as often and things like that. So overall, I just think it's very mentally draining.
Yeah, definitely. And also, how you said, it is physically draining, cancer. And I do think that brought up a good thought, how maybe the physical aspects of cancer does affect mentally, maybe because of the physical changes that are caused by cancer. It can also cause mental like problems. Maybe they feel insecure about how they look because of these cancer treatments that are affecting their physical appearance. So from my research, I figured out that it can cause a lot of PTSD. From this info, we can assume that maybe any other visit to the hospital, even if it's nothing related to cancer, can be a traumatic moment or at anything that may alert them, like maybe a simple cold. From my research, I've also found another interesting thing that without frequent contact with medical teams, it can raise a lot of anxiety. And so that makes me question that is it possible that some may think like this because they believe or know that with earlier medical care or attention, their journey with cancer would be easier. And so now that they're not in contact frequently with medical teams, they're afraid that these series of events that occurred in the beginning stages of their journey with cancer may repeat.
Yeah, I feel like that's like a really large part with PTSD where you fear that a series of events will like happen again. So I think that because people may not have this like constant medical attention where it's like, oh, you are fine now, or you have this, like even after they hear that maybe they're free of cancer, like because cancer is known to come back, I think that without that constant medical attention, they could like it's very possible that they think that it will come back and maybe be even worse than it was the first time. So yeah, I feel like that's why I don't know how you're supposed to make that better though, because I don't know that constant medical attention is like the best thing either, because that could also be very anxiety provoking because you may not like what you hear all the time. And just some things like I found from research, I found that pediatric cancer has similar harmful effects on brain development as chemo brain does in adults. So it's like the effects are like attention issues and memory issues and also language issues. And a lot of times it can be difficult for people to express emotions and can cause depression and anxiety and also PTSD, as Taskin mentioned. And it also can be difficult to create and accept relationships with others because you're like losing so much early on. And it also can cause behavioral issues. And like just thinking about how all these issues, like they're so similar to the effects of chemo brain on adults. Like I'm just thinking about like how much, like if you're so young and these things like your memory and language, like those things haven't fully developed maybe, but now you have like all these different things to handle with cancer. So it's just, yeah. And also I found that mental effects can affect the nervous system and increase your risk for like physical and mental health problems later on, which also like plays into how you're talking about how people can get scared if they're not having constant medical intervention. And that's because like cancer is known to possibly cause like other issues or come back in the future. And also I found from a study and other research that while most childhood cancer patients have found good ways to cope and be mentally healthy, they still experience PTSD, anxiety, and or depression. So it's very common. And PTSD is prevalent in almost 75% of children during or after treatment. And also, I thought something that I hadn't considered before was that there's not only a mental toll on the children, like on the cancer patient, but there's also a mental toll on the siblings and parents of childhood cancer patients. And it causes a disruption to normal life, like not only social development, but it also causes a disruption to academic development, which can be very harmful mentally.
A good point you brought up was about the mental toll that it takes on the people of the child with the cancer. I didn't know that. I was mainly focusing on the psychological impacts on children itself, people that are suffering with cancer, but not like the parents or siblings. I've heard that because they are not emotionally available towards their children with cancer, it means that they're not emotionally like ready to deal with it. Mm-hmm. And so I think we do have to talk about that not only do the patients themselves get affected, but so do their parents and siblings. And also some similarities between our research was like anxiety or stress. And also like it affects and disturbs like normal life. According to the APA Public Interest Government Relations Office, children with leukemia report missing between 10 to 20 weeks of school in 1 year, and as a result, many of them repeat grades. So because of this absence from people, whether it's from friends from outside or just the school environment itself, going back into these environments can have such a huge toll mentally on kids with cancer because they're not used to such environments. So it can cause a lot of behavioral or social problems. Some may also face anxiety or stress because of these absences that prevent them from learning. And also, the OHSU Knight Cancer Institute explains hormones being an aspect affected by cancer. This can cause mood changes that can contribute to the psychological impacts of a child.
Yeah. I feel like just as a whole, like we don't really think about how much mental health is impacted, like with everyone, like around people, not only a cancer patient, but just everyone around them. And that's why it's so important that, especially with pediatric cancer, there's more like knowledge, like parents talk about it more and things like that. Because if your child like hears that someone like a peer or classmate, like they know someone that now has cancer or something, they may not understand it. And because of that, it not only has a mental impact on them, but also when the cancer patient comes back to school, like it can have an impact on their environment, who they're friends with, and things like that. So I feel like just from hearing about your research and then also the research I completed on my own, like I feel like the biggest things we found are that there's very large impacts, like, and especially PTSD. I think that's one of the largest things, because maybe not everyone will get depression and anxiety after having cancer as a child, but they're very likely to have PTSD. And I think just because we both found PTSD as such a large part of both of our research, it just shows how big of an issue it is, and just how important support and like easy access to mental health support is so important. And yeah, do you like have anything you think about?
I also do agree. From our research, I've seen that PTSD was the biggest part of both our research. One thing I did notice was there wasn't a lot of info towards like other things for besides PTSD. I feel like personally for me, because I couldn't really find anything besides that. They were often just repeating, and there wasn't actual research being done. So I kind of do think that maybe that also is an indication that mental health really isn't focused on for children with cancer, because I couldn't find a lot of stuff specifically on anxiety or depression or any other ways besides being in the school environment or going back to the school environment that affects children with cancer.
Yeah, I didn't actually like think about that. Like, because when I was doing my research, like I found like effects on brain development and then like PTSD, and how anxiety and depression were sometimes common, but they weren't like as prevalent as PTSD. And like because there were so little studies, like yeah, I think there definitely does need to be a lot more studies, because we need to see how, like, we need evidence of how much it's impact. Like, although we know that the mental impacts are very large, I feel like we need more evidence of that, because there's such little support. And if we had more studies done, like people would see the need for more support. And also something I hadn't considered like before research, like was just like the mental toll on everyone around the cancer patient and how like big that is. And also like, I don't know if this is a thing already, but maybe like, I feel like I haven't heard of like cancer support for entire families after. Like there's obviously like I think there's like support programs for families with people that have with like drug issues, like alcoholism, things like that. But I haven't heard of like family support groups for children with cancer, or even just people with cancer as a whole. I feel like that'd be really important, just because of maybe people in the family of someone with, so maybe like the siblings of a child cancer patient, they may be scared to express how they feel because they may think that their feelings aren't as important. And I feel like that's something that definitely needs to be talked about more.
Yeah, back to what we were saying about how it's not talked about a lot, like how you haven't found a lot of deep research on it. Because in terms of like other topics like alcoholism or anything like that, or smoking, usually you'll find specific research on it or studies being done online. But I haven't found any of that. Usually whenever I went to the websites, it would just be like a paragraph about like how PTSD or anxiety or depression are common, which is common knowledge. does happen. It's not like surprising that it does happen, but I feel like we do have to do research on it. And another thing that you brought up was about the effects that it has on people around. That isn't talked about a lot. I think it should be, because oftentimes we don't see how it takes an emotional toll around other people. And honestly, we should focus on that, because these people that are around the children, right, whether it's the parents or siblings, they're a huge part of the child's life. And they do, because their mental state also affects the mental state of the children. So if they're not emotionally available, neither is the child. And the child will probably also face the same mental problems, just like their parents do, because of the cancer.
I think that's a really important part. Like, I didn't even like think about it like that, but like that's like a really important part, because the people around someone with cancer, they're going to affect them so much. They're going to affect like how their like attitude towards cancer and like how they're feeling. Like, they're going to be around them all the time. So it's so important that they are okay. Like, they have to be okay so that they can make sure that the cancer patient's okay. And also, like, I just feel like not only like have studies not enough studies have been done on like the mental effects, but also like we just don't learn about it. Like, even in school, when I talk about cancer, which we barely talk about cancer in school as a whole, but like in my health class, like we'll talk about all the effects of like drugs and alcohol and all this stuff. We will mention cancer. We'll talk about how to avoid cancer, things like that, but we'll never talk about the mental impacts and how important that is. And I think that's very important and just needs to be talked about more.
That's a good point you brought up. How schools, I didn't even think about that, but like how usually you'll see how they're mainly talking about how to avoid cancer, but a lot of times cancer isn't avoidable. It happens.
Yeah.
These children, they don't want cancer, but they get it. No one wants cancer, and it's something that sometimes it's unavoidable for a lot of people. So it's like maybe we should focus on how it does mentally impact not only the patient, but like the people around them. And also not just like the negative aspects of it, but like also how to improve from it, and not just talk about how to like avoid it entirely. Because if we talk about that, we're not going to get anywhere, and we're not actually going to help people that already have cancer. So my expectations before this research is pretty similar to what I found for this research. I mean, I expected that they were going to suffer from depression or anxiety or PTSD. But one thing that was surprising to me was how a lot of them do face anxiety because they're not in constant communication with their medical team, which is surprising to me. One thing that Sophie mentioned was how this constant communication with your medical team can be stressful because you're constantly worrying about what they're going to say, compared to like if you weren't having constant communication with your medical team, it'll just, I mean, of course, it'll be a worry in the back of your mind, but regardless, you wouldn't be constantly worrying about it every single minute of your life. And I feel like my perspective on that really did change right now from the research we've done, because now I can see that people with cancer, they have a totally different perspective. They instead feel like that this constant communication with their medical team is beneficial to them rather than not having communication at all. And I think that's worth mentioning because now we understand why they feel like this, because the medical team is probably like such a huge part of their life. They're constantly interacting with them. And so because of this interaction, it's hard to just like give up this interaction, not communicate with them, especially with people that have helped you battling cancer. So I feel like it really did shift my perspective on that.
Yeah, and just like with your last point, like how the relationships with the medical teams like at the hospital are so important. And I think it's also because like something I found in my research was just that it's hard for children with cancer to accept or create new relationships after the battle with cancer. And I think that because they're always with their medical team, like the relationships that they build with them are going to be so crucial, because while they're going through all of this, like they have the medical team there. So like because it's so hard for them to create new relationships after cancer, like the relationships they have built like during the journey are going to be so important. And also just what we were talking about before, like how the mental aspect of like the mental health of people around the cancer patients have such an impact on the cancer patients. Like the mental health of even the medical teams will have such a large impact on the cancer patients. And because of that, it's like it makes sense now. I feel like I didn't consider this before, but it makes a lot more sense why they want to be in communication with them all the time, because they built such like good relationship with them. And maybe if their family like wasn't mentally okay during their battle with cancer, like the medical team had to be there for them. The medical team had to be okay, so they'll feel okay. So I feel like it's very important. And also like just other things like that of mine that have changed like after my research. I feel like like from what I found, the mental health in the cancer process, like it isn't prioritized like how I expected. And it needs to be like how we were saying, there need to be more studies. Like I feel like it needs to be more prioritized. And also I expected the brain to have like a lot to do with everything. And like a lot of what I found was just the effects on brain development, like attentive issues, memory issues. And that's like, it's so big for especially pediatric cancer because they haven't fully developed their attention issues or their memory issues and things like that. And also like just other things I expected were that like the therapy and support options weren't the best. And I feel like we have found that they haven't been the best because there are all these different things going on, and people may not always like seek help because they don't think that there will be support for them. Yeah. And then also like one other thing that I didn't really consider until my research, but I had learned about before, was kind of just stigma on about mental health. Like mental health, even just like outside of cancer, it's not always talked about, and people don't really see physical health as important as mental health. Like last year in a bunch of my classes, we kind of talked about how there's always been stigma against mental health and how that stigma has limited access to mental health care, especially in like low income areas and things like that. So I'm just thinking about like with cancer, like on top of that, if you already live in like a low income area and then you also have the financial burden of cancer, like that's going to be so big, and that's going to limit your access to mental health care even more, because you're only at that point, you're only going to want to get rid of the cancer. You're not going to think, oh, I need mental health like help after this. And I feel like this plays like this mental health stigma, it still exists today. And that plays a large role in the lack of access and lack of attention to mental health care during and after the cancer process. And yeah.
I totally agree. One aspect that you brought up was the financial thing. Usually, whenever we do talk about like an illness, for example, cancer, we usually associate it with like the physical burdens of it, and how even if we do mention the like the mental aspects of it, it's usually because because our physical appearance changes, so that's why we feel like we feel that we have a low self-esteem, or because we can't interact with people because we're always interacting 24/7 with the medical team. So, but a lot of times what we fail to realize is that financial burdens also affect them as well. And childhood cancer, it doesn't just affect like toddlers or like 2-year-olds. It goes up to like teenagers too. And they understand the financial burden that these cancer treatments possibly can have on their parents, and that could also affect themselves as well, because they're constantly worrying about how, will my parents be able to pay this off or pay this treatment, or will I be able to even get this treatment because my parents don't even have this much money to pay for it. And as you said, mental health, there's a stigma around it, and maybe a lot of times these kids that they know that they're suffering mentally because of cancer, and they want help because of it. They're not able to get it because of the stigma surrounding it, and because they think that it will be a financial burden, because even getting mental help costs a lot. And it's sad because they need it, and especially like on top of suffering from cancer and like the physical burdens of it, on top of all that, they're going through hardships mentally, and so having to deal with financial burdens because of their physical appearance or getting treatment, and also mentally, it takes such a mental toll at such a young age too, especially because you're just a teenager or you're just a child. You don't know anything, and it's so hard having to deal with so much things on top of dealing with cancer.
So some of my research that I haven't really talked about yet was just like the presence of mental health support in hospitals. So I found that not every hospital has psychosocial support, which I kind of expected. But I also found that some support doesn't even extend past treatment, which it's just a little shocking. Just because I feel like we've talked about like all the impacts like after, like even if you're a child, like the mental impacts could extend like way into your adulthood. So I think it's so important that support extends past treatment. But some positive things I found, like some institutes like Rutgers Cancer Institute in New Jersey, they have programs where they follow up with patients and evaluate their mental state to see how they can best provide psychosocial support. And also other things I found were that studies have found that nursing intervention, it needs to improve to help children cope with the physical, emotional, and psychosocial burdens of cancer. So, like, we talked about how there needs to be more studies done to like find the mental impacts of cancer so we get more support. But there have also been studies done. It's just they don't have enough attention. And because our podcast is about like trying to not only share our perspectives, but also share how people can get support and seek help, I think it's really important that we talk about that too. So like some of the research I found that to know when to seek help, if you experience like changes in appetite or weight, low energy feeling hopeless, increased irritability, increased worry and anxiety, or just unwanted memories about cancer, or feeling like fearful or upset or angry when you talk about cancer or think about cancer, that's definitely when you should seek help. And seeking help is definitely important, even though it may be scary.
So I also think that it's important that we follow up with them throughout their adulthood as well, because as you said, it doesn't just affect them as a child, but it can go through them being an adult. So I do think that's also important. I also think that like from my research, I found that like acceptance is also important. As you said, like since there's like this stigma around like mental health, and it's often seen as like something not to be talked about, or something that you shouldn't have. Acceptance is such a huge thing. Like accepting the fact that it's okay to have these type of feelings can really change a child's perspective, because children look at things through different perspectives and through different lens. And so if we can make them change their lens or perspectives at how they look at things, it can really make a huge difference. Also, I've seen that physical activity can also help. It can take their mind off of like all these mental aspects of cancer and all these mental problems. And also communication is also key, since talking with others can relieve the pain and provide reassurance to children.
And also like just to add on to that, like if there are support groups with families, things like that, like if you are a family member of a childhood cancer patient, or just a cancer patient in general, like it's very important that you also consider your feelings and you try to talk about them with someone too, because that's going to also impact not only your mental health, but it impacts all people around you that are also dealing with this. And also, I feel like it's important to note that these feelings are very common, especially in childhood cancer. Like years later, maybe it won't have that much of a mental impact originally, but like years later it can. And it's important to talk about how you feel, like how Taskin said, to people you know, and like your family, friends, even other survivors, or medical professionals, in order to get the help that you need. Because it's just very common to feel fearful about this topic. And and just something like some professionals that I found that could help if you do need this help: psychiatrists, psychologists, and neuropsychologists, as well as mental health nurses, clinical social workers, counselors, and pastoral counselors. And also medication can help as well. There's so many different things. Like everyone's gonna have a unique experience when it comes to how you feel mentally due to cancer. So it's important to consider all these different methods and try to find the one that works for you. Maybe you'll try medication, it won't work, but maybe you can speak to a professional or a family member, and that will have a larger impact and help a lot. If you or someone you know are looking to support childhood cancer patients and help them to experience a better childhood, but don't know how, Cancer Kids First may be the answer for you. Cancer Kids First is a nonprofit organization started by high schooler Olivia Zhang that aims to improve the childhoods of cancer patients. Throughout volunteer work, donations, fundraising, and the creation of this podcast, those working with Cancer Kids First work to further its mission. If you're interested, go to www.cancerkidsfirst.org/get-involved to get involved.
Another way to support the mission of Cancer Kids First is to listen to this podcast and follow us on our Instagram and TikTok at the Gold Ribbon Podcast and Twitter at TGR_on-air. You can also get in touch with us through our email, thegoldribbonpodcast@gmail.com. Episodes will be airing 2 times a month.
Thank you so much for joining us on this episode of the Gold Ribbon Podcast.
If you have any ideas for or want to be involved with future episodes, make sure to check out the link in our Instagram bio.
Have a nice day, and we'll see you in the next episode.
Bye.